Welcome to the Ostomy and IBD Live Show, a place where we get to talk about all things about having an ostomy or Crohn's or colitis, from the physical to the mental and the emotional. My name is Elaine O'Rourke. I have had my ileostomy for 15 years due to Crohn's disease, and thankfully I have been doing awesome since I had few organs removed. Every week we talk about something different, and this week we are talking about men's health, specifically in regards to sexual issues and fertility. So all genders, we have a lot of overlapping concerns or things that might come up in regards to intimacy and even just confidence, body image issues. Even if like depression can be a big thing. And so then you're not really feeling very attractive or sexy. But tonight we're just talking about the males and the male anatomy. And so my special guest is Dr. Neil Nandi. He is awesome. I saw him talk at the UOA conference last year, and he also does, he's given great presentations with the Girls for Guts organization. So he's wonderful for all genders to be speaking about sexy time, as he refers to it, or at least I've heard him refer to it like that before, and I think he is fantastic. So I'm going to bring Neil in to join us. Bring him in here. Oh, and even before we get started, hi, Dr. Neil Nandi. Thank you so much for joining me tonight.
My pleasure. Thank you. And I'm glad that sexy time, I'm glad that stuck. It's memorable.
I just love how you refer to it like that. It is awesome. So Dr. Neil Nandi, you are an associate professor of clinical medicine at University of Pennsylvania, and you're also an IBDologist at UPenn. So I know you have tons of experience with all of this, and I do want to just let people out there know that you can follow Dr. Neil Nandi on Instagram at FitWithMD. And you can also follow me. I have a new Instagram page called Ostomy IBD Life. I thought it had some continuity within all of my stuff. And then on Facebook, I'm on Ostomy and IBD Life. And on YouTube, you can follow me there on Elaine O'Rourke Yoga Ostomy IBD. And it's always really helpful to just give us a thumbs up or a comment or to subscribe to the social media. Also, another thing before I get into our wonderful conversation, which I'm very excited about with Neil, is that you can hop on my website and sign up for my free guides. So I work with people more with the mental and emotional issues in regards to, say, intimacy, in regards to communication, about how you feel about your ostomy, how you feel about Crohn's and colitis, and really work through those challenges. So I have a free guide on my website, which is elaineo'rourke.com, and you can download your 3 ways to eliminate fears around your ostomy there, and also another one for people with IBDs called Hidden Causes, 5 Mistakes Even Well-Informed People Make with IBD. So right now, let's get onto our topic tonight, which is, as I said, men's health. Let me just bring this one up here so we can all see it. Men's health, sexual issues and fertility with IBD or an ostomy. And we will also be covering, with an ostomy, people get ostomies for all sorts of reasons. So, we will take into consideration people who have had, cancer, going through chemo, radiation, all of that sort of thing as well. So first of all, Neil, thank you so much for taking your time out. I know you're an extremely busy man, so I appreciate this. And, I appreciate all that you do for the community, because you do come on shows like this. You do help people with all of your knowledge. So thank you so much for that from the bottom of my heart and everyone else's hearts.
It's my pleasure. It really is. And thank you for having me. And, I just want to, again, I said this before the show, but I wanted to share it with our viewers who are tuning in. Please all thank Elaine for using her platform in such a socially responsible way elevate and promote education on this. Really, this is part of men's health. And oftentimes, I don't think men feel like it gets attention. They may even feel it doesn't deserve attention, but it really does. So, Elaine, I want to thank you for not only having me, but having this topic as a show, as an episode, as somewhere, as a resource for our people who are viewing this. Thank you.
Oh, well, thank you for saying so. And I think that's just from the get-go there. That is really important thing to say, that, these subjects don't get enough coverage. And, I know when I was going through Crohn's disease, there was never a conversation about, how things were working sexually or how you felt in that regard. And I know it is being discussed more and it is becoming more open. But, for so many people, it can be taboo. And even still now it can be. And women, we tend to talk about things a little bit more than men do at times. So I'm really glad to be bringing this out because it is something, and it is an issue that men do have these problems and concerns as well, and might be a bit shyer about asking questions. So if you're out there and watching, please post up your questions, or if you want to send questions private to me, you can do that through social media, and you can also message Dr. Neil Nandi again at Fit with MD. I know I've heard you say that before, that people can message you directly there. So
actually, if you do message me, it's FITWITMD. No with.
Oh, I better fix that.
Because if you do have questions, if you DM me, I will get back to you 100%. I always do, but I just want to make sure you can find me. That's okay.
All right. Say that again. It's
Fitness Witness, Fitwit MD, FITWIT MD.
Yeah. Okay.
That's
Thank you so much. So let's get into and we're going to start off from the perspective of having IBD, so like Crohn's or colitis, first of all. And can you tell us, does IBD affect the male anatomy in regards to sexual function, say like without having any surgeries at this stage, just having Crohn's colitis?
So it can, depending on the type of IBD that you have. And really what I'm referencing is in terms of just sexual activity, libido, desire, having any chronic illness, when you get diagnosed with any chronic illness, it has been shown that it actually decreases libido in general. And this is across the board. It's not something that's unique to IBD, but any chronic illness diagnosis can decrease libido. There was a study looking at body image satisfaction before and after simply a diagnosis of IBD, and it actually decreased libido in women, in 1 in 2 women and 1 in 3 men. And that's if they were being honest on questionnaire surveys.
Wow, that is huge, right? And most people, like a lot of people, as you say, probably weren't even being honest about it. That is fascinating.
Yeah. And then in terms of when you actually have disease activity, again, some of the obvious I'm sharing with our viewers, if you're dehydrated or in pain, that actually obviously, common sense has an impact on your libido. When you have complications of the disease, that too. So in men, we don't talk about it. We may not see it as often. In women, we talk more about complications of fistulizing Crohn's, such as rectovaginal fistula. You rarely hear men talk about it. 1, because it does seem to be a little less common, but 2, I think that men aren't as open about it. Some men have had fistula to the scrotum before, which obviously can be very traumatic. It's not as common in my own clinical experience. But obviously, that's going to have an impact on sexual function and activity. But that's the rare. So having IBD alone certainly can impact your perception of libido psychologically, and if you're in the mood. And depending on the severity of the disease, certainly can have an impact. Really, and we'll get into it, the concerns are about medicines. That's the most common question to treat IBD, and surgical impact, right, upon sexuality and intimacy.
So then, like, how does medication affect the sexual function? And again, for anyone that's just beginning to tune in, we're talking about in just specifically in regards to men's health. And please post up your comments. We'd love to get your questions.
Yeah. So oftentimes the question is, when it comes to medications for IBD, a common question is this affecting my libido? Is this affecting my sexuality? By and large, if you were to Google this, and you can only trust Google as far as you can throw Google, as far as you can throw your monitor, okay? Because what you may find online may not really be from clinical trials. So I always tell patients that there's a lot of things reported online, but you need to have, go to a trusted resource. Clinical trials may list, if a patient, if you look on the package insert, if a patient in a trial ever reports anything as a side effect or adverse event, it has to be and must be categorized and included. So that's why you may find things in a package insert, but it doesn't necessarily mean they're common. When it comes to IBD medicines, and specifically I'm talking about like biologics, commercially known as Remicade, Cimzia, Simponi, Humira, Stelara, Entyvio, Xeljanz, those medicines that have been approved for Crohn's and or ulcerative colitis don't necessarily have an impact on sexual function. One of the medicines, though, not the biologics, called asulfidine, also known as sulfasalazine. It's the precursor to mesalamine medicines. So not the mesalamine, but the precursor, sulfasalazine, has an impact on your swimmers, men. It affects how well your swimmers, your sperm, can swim. So it actually can have an impact on motility of the sperm, if they're fast, if they're slow, and if they can't. So fortunately, that is a medicine that you can stop, and 3 to 6 months later, you can have swimmers that swim well and win Olympic championships. But it's important, right? So it's a commonly prescribed medicine, especially for ulcerative colitis. And, if you're on it and you're trying to conceive and you're not able to with your partner, this is probably a number one reason. And so if you and your wife are visiting with the MFM specialist, the maternal fetal medicine specialist, your OB, and trying to figure out, why you're not able to have a successful embryo, it may be because of sulfasalazine. And it should be something that the doctor asks you. And if they haven't, now you know.
Right. That is really good to know. Yes. That I didn't realize. Well, I wouldn't be looking at it from the male perspective myself, but that's really, really interesting. So that's the only medication that would affect fertility for men.
Fertility. There are other medicines, if we're being broad, such as prednisone, right? Which is
right, and that's a lot. That's one that a lot of people go on. Yeah.
Yeah, and prednisone is one of those necessary evils at times. For those people who respond to it, it's necessary in order to get some remission, to have a little bit of a break. But it comes, especially if you're on it chronically, with a lot of different side effects, such as acne, hair, hirsutism in places where you didn't want it, decreased libido, depression, anxiety, insomnia, muscle ache and fatigue. And the reason and that's just some of them, okay? Yeah. And the reason I mentioned those in general, and also weight gain. I
remember that. I remember getting the big steroid cheeks.
Yeah, and we call that the moon faces, right? Sometimes you get the buffalo hump if it's swelling, right? And it can lead to scria, which are stretch marks, right? And all of these things are not just cosmetic. Let's not say it's superficial or abnormal to think, about our own vanity. We all have some pride in our physical appearance, and when these things happen to us, the stretch marks, the weight gain, the moon faces, it affects our self-perception, right? So that too, would be a medicine in IBD that can affect our sexual desire, intimacy, and satisfaction.
Right. And then in regards to any other things in regards to IBD specifically, in regards to, would that affect how a male would perform, or was there any reason just with Crohn's or colitis that would affect just the physicality of, say, getting an erection, or is it just more that how one is feeling about oneself?
So, it's important that you ask that question. When we look at female arousal, there's different phases. It's very complex. And likewise, men, I want to tell you men, because we're focusing on men in this program, the running joke is that we just have an on-off switch, right? But for many people, that may be jokingly true, but it turns out there are multiple factors, right? Certainly there's arousal, okay, but there's also other things that influence our psyche, our ability to be intimate, and that is feeling well, feeling sexy, feeling confident, right? And in addition, there's the anatomical things of what physiologically creates an erection. So when it comes to body image and IBD and steroids, that can affect our self-perception. It can affect our confidence. It can affect how our arousal, how our libido is translated into arousal or an erection. I can't emphasize enough that this is an important part that you can, if you're having difficulty with arousal or erection or libido, all of these things are intertwined. It's not all in your head, as we're going to get into, but there is a normal, and I mean that, a normal aspect of having this chronic illness and the medicine side effects where it decreases your psyche or libido to participate. And if you recognize, and this is a mental game to some degree, if you recognize that this might be applicable to you, then it becomes a potential avenue that you can overcome or start to reset your mental baroset, how you think about your own sexuality, your own confidence. And it's something that you should talk to your doctor about. We'll talk about resources for these things in a bit.
Yeah. And I know myself, that's where I work a lot with people, is overcoming so much, the things that we can actually have control of, such as building our confidence, reframing how we're thinking about our bodies, and just getting a better handle on that sort of thing. So that is something that we can all be working on ourselves or seek help with.
Yes. And Elaine, I want to, I just wish you'd moved to Philly, Elaine, because what you just said there so beautifully is it's what we have in our control. Too many times in IBD, we feel a lot of things I think are out of our control, right? Yeah. This is something within your control, and it's something within your own power. And if you don't think so, if you need some help, then I want to encourage my men who stereotypically, this does not apply to all the men tuning in, but stereotypically we are considered that we don't like to ask for help. But I want to tell you, ask for help. Look to Elaine, look to counselors, look to therapists who can help you, or talk to somebody, because someone else can help you and it can pay off. The other part, Elaine, that I brought up was erectile dysfunction, which is a phenomenon that affects men whether or not we have IBD or not. It's normal that as we age, men get erectile dysfunction. It gets harder to have an erection for men. Part of that has to do with atherosclerosis, blockages in the heart artery, that gives blood to our legs, our organs. That can also happen to some of the blood supply to our penis. The penis, in truth, becomes engorged with blood in the corpus cavernosum, which are large veins that fill with blood, but there is arterial blood supply. So tobacco and smoking, which is a no-no in Crohn's especially, tobacco can also cause libido issues or erectile dysfunction issues. And that's something in our control too, which is to stop smoking. That's just the tip of the iceberg.
Right. And then, when we're going through flare-ups, I'm very thankful I don't experience Crohn's disease anymore. But when you're going through a flare-up, you are not feeling sexy at all, so a cuddle might be all that one would be able to do. But, also, I was thinking about this today, if you are in a male same-sex couple and, your sexual preference is like anal sex, this is going to be a huge factor within a relationship. And I would imagine that there's a lot of, emotional content around that, never mind just the physical. But, physically, what do people do? Do they just have to take a break from the actual physical anal sex at that point? Or what have you heard from your patients, or what information you have in that regard?
So one, in terms of formal literature, and this is a huge shame of the field, which is that we do not have enough literature, at least IBD specific literature, right, for our LGBTQ population at all. We don't have enough studies. I mean, there's barely any mention of it in most guidelines from most societies around the world. The ECHO, which is the European Crohn's and Colitis Organization, has one little blurb that recognizes that they don't have literature on this, and the American guidelines do not have that mentioned yet, to my knowledge. So we need to know more. What I can tell you is this: it depends on anatomy. If someone has active proctitis or active rectal disease, we ask patients to refrain from anal intercourse. And it's very frustrating if that's what gives them personal and sexual satisfaction, because it's a big deal not to be able to engage for both individuals. If people have a pouch, similarly, we ask them to treat it with care, especially if there is especially if they may consider reanastomosis. Now, that doesn't mean that there cannot be any anal foreplay. So sometimes, although we may discourage penetration, there can be a lot of satisfaction from foreplay or just stimulation around the anal canal. The pudendal nerve, which is the major branch from the sacrum, has 3 areas of innervation. Let me get to the camera. One may go to my thumb, you can imagine, goes to the clitoral head or the head of the penis. The second to the perineum, which is between the genital and the rectum. And the third goes to the rectal area. And that's why that entire area is so sensitive and can be stimulated very quickly and create, incredible amounts of pleasure. And so that is one area that maybe, that you can still stimulate and gain pleasure. But by and large, we may, depending on a case by case, we may discourage penetration or encourage caution.
Right. Yeah, that makes sense. So for our viewers, please post up any questions. I'll just pop over and see if we have any comments or any questions right now. It's also, I love to hear where you're tuning in from, or whether you have IBD, whether you have an ostomy. So we have Janine, that's my sister, saying, great topic. Thank you both for talking about a subject so many practitioners avoid. And my sister is actually a GI nurse as well. So she's familiar with all of these topics and sees patients all the time as well. And Tony Real says, hi, gorgeous lady. Well, hi, Tony. Thank you.
I was going to say, thank you for everyone tuning in. I was going to say, if there are any LGBTQ, and that's a huge, broad crowd. But if there are anybody who has, one reason I do this is so I can learn new perspectives or tips. So if there's anybody who's tuning in who has a different experience or has a suggestion, please share it with us all, because then we can, share the knowledge, and I myself can even learn too, Yes,
exactly. That's why I love this show, because I'm just learning new stuff constantly. It's amazing. So then, Neil, let's talk about then when someone has an ostomy. Let's say start with just has their ostomy but hasn't had rectum or anus removed. So just, say just starting off ostomy, whether it's temporary or permanent, but without any further removal of anus or rectum. Now, what issues would a male expect to or could come across in regards to sexual function?
So, here's the thing, the numbers when it comes to erectile dysfunction. So if you have had some surgery near the rectum, or you've had some removal of a portion of the rectum, the numbers will say 2 to 3% max may experience some change in their ability to achieve an erection. Mm-hmm. That's not a high number, but if you're the man, you're the patient, that's a big deal. Yeah. And no matter how a surgeon, for one, you should ask your surgeon that question. And if they don't have an answer, there's a problem, okay? But they should have an answer, okay? Ask them, how they try to prevent that. And they'll tell you that they take great care to make sure they don't cause nerve injury. And they're very good. Our techniques and the skill sets are so much more advanced than they used to be. But there's no guarantee that a nerve may not be injured, even though it's so rare. So that's just something, it's hard, that's the honest truth. It's no one can give a guarantee that there won't be some change. The majority of patients, though, will not have an issue with achieving it if they've had some surgery. Now, what changes, though, Elaine, is if there is more deeper surgery where there is if you had deeply penetrating rectal disease or the pouch had to be completely removed or excised, then the more pelvic surgery there is a slightly increased risk of injury to the nerves that help send the signal to create an erection.
Oh, okay.
So it may be more common then.
So
that is a concern.
Sorry, I interrupted you there. But would that be in regards to, say, so then let's talk about, so if someone has to have their rectum removed, then what happens?
So again, the majority of my patients have not had issues with erection, but there is an increased risk of there's an increased risk of nerve injury, and there can be some erectile dysfunction.
Okay.
I will say that if you are a male and you are someone who has not undergone a proctectomy or has not had, but that may be something in your future, possibly. If your doc has said, hey, you may need some more surgery in this area, a rectum may or may not need to be removed, or we may need to do more pelvic surgery. One thing, if you're a male who wants to reproduce, okay, you may want to consider consulting with a urologist or a service that freezes your sperm. Okay. Just like women, we speak to them sometimes about freezing eggs. Mm-hmm. It may not be out of the realm of planning to have your sperm frozen. Now, everybody's different. And again, I have to emphasize as a doctor that my suggestions here shouldn't be a substitute for the medical advice of your own doc. And yes, everyone's unique, total unique. So, talk to your doc and see, is that something that you need to consider? It may not be. They may give you some other reason for reassurance. But if you are thinking about it and there's a risk of more surgery, a risk of dysfunction to create an erection, you may want to bank your sperm.
Right. And that's a good point. As always, this is an information and education program. Always, even though I've had on many nurses and doctors on, you still need to go and talk to your medical field, your medical team, because they're the people that know your history. We don't, so we can only give suggestions and more like broad answers with some of that stuff.
Yeah.
So what about then when someone has, because I know for women on some of our previous shows, having a J pouch is going to be different than in regards to, for pregnancy, fertility, all of that sort of stuff. Is that also the same? Can you talk about that in regards to males with a J pouch?
That's a great question. The short answer is no. But let me make sure that our men are on the same page with what Elaine has learned a lot about, which is what Elaine is referencing. In women who have had pelvic disease and pelvic surgery, their fecundity, not their fertility, may be impaired. What's the difference? What's fertility? What's fecundity? Fertility means, do their eggs function? Can they be inseminated? For men, that means, do your sperm swim? Do they function? Can they inseminate an egg? Fecundity refers to the ability to have a hospitable environment to create it, to take that egg and carry it through full gestation, through full 9 months to birth. What that depends on is the environment. So if I'm an egg in my little egg and I'm looking around, is there active disease in another organ that's transferring, right? The bowels are near the fallopian tubes and ovaries and the uterus. So if there's active disease, that can impact the environment around the egg, and it may cause a miscarriage. If I've had surgery, again, pretend I'm an egg in the fallopian tube. If there is scar or adhesions from surgery that wrap around the outside of the fallopian tubes, that can prevent drainage of normal fluids down into the uterus It can, change the transit of the egg. It can create an inhospitable environment, again, that can impair the egg going to fruition, going to full gestation to become a baby. For men, we're different. Our gonads are not inside our pelvis. They're outside our pelvis, right? They're temperature controlled in the scrotum, hanging down outside. So by and far and large, most men, after they've had surgery, their fecundity is not going to be affected because they're not taking the baby, right? They're just providing the sperm. So their fertility is not being impacted typically either. It's that sperm getting out, right? How does the sperm go from the testes out to be ejaculated? So the things that can affect that are nervous stimuli through either arousal from the sheer mechanics, a caress, a stroke, or the nervous stimuli from the brain down. That's another type of that type of arousal. And then also we talked about meds that can affect the swimmers, like sulfasalazine or asulfidine, which affect motility of the sperm. And then if you have active disease that actually penetrates near the testes, which for most Crohn's patients is uncommon. Otherwise, your fertility should be preserved. Again, getting the sperm out is the issue. So if there's an issue with erection or more pelvic surgery, you again may want to consider sperm banking.
Right. That's great advice. And then in regards to people who have gone through cancer, so, whether you've had rectal cancer or whether you're going through chemo, radiation, how does that affect the male? And even in regards to medication, so say if someone has IBD and then is also going through cancer, so there's kind of two different questions there. How does that affect the male? And then how does, say if someone has even pelvic cancer, rectal cancer, how does that affect the male? Or what could be, are you familiar with complications or some things that are a bit more common?
Well, I think that it's a broad question, but it depends on the chemotherapy that you're receiving, what kind of consequences there might be. So that would be dependent upon the medicines themselves. I think radiation that you said, that's another certainly concerning thing. If you're undergoing pelvic radiation for a rectal cancer, certainly they try to make sure that the beam is focused only on the area that needs to be. So if you're a rectal cancer patient, you met with your radiation oncologist and they've kind of put beads and dots on you to map out exactly where they're going to, give the radiation, and they try to avoid the sexual organs. But it is a possible risk. So it's something, again, you should ask. I do want to stress, we always go to the doc and ask about, because I'm a patient for other things too, we always ask about the side effects and adverse events, but rarely do men, less so than women, that's for sure, ask about the sexual side effects. So if you are undergoing radiation therapy, ask your radiation oncologist. They'll tell you exactly, because they're trained to actually ask this question of their patients. How is your sexual life? How is your erection? How is your arousal post-radiation? It should be something that they're asking you anyways. You mentioned surgery. So we went from meds, radiation, and surgery. The deeper surgeries, where there's more pelvic excavation, are more associated with nerve damage and may have a higher risk of erectile dysfunction. So again, it's one of those things you have to be aware of, and you may want to check yourself with what your insight or what your sexual desire and libido are before you undergo surgery. One thing I would recommend if you haven't undergone that kind of surgery for pelvic cancer is talking to another patient in your doctor's practice. Ask if anybody feels comfortable. You can ask online too, but sometimes your doc will have, we have a group of a few volunteers in our clinic who help with questions our ostomates have. So your doctor may have somebody for you to talk to, and you can ask them, hey, how was your sex life affected? That's really useful too.
Yeah.
And something I forgot to mention when you mentioned medicines, Elaine, for our men out there, there are other medicines that so IBD, you can have IBD, but you can have other illnesses that go along with it that have nothing to do with IBD, like hypertension. High blood pressure happens as we get older regardless. Another thing that we don't like to talk about, depression. Depression normally and naturally increases as we get older, okay? And so does, at any point in our life, the risk of substance abuse, okay? And we may not know we're abusing it. I'm talking about alcohol specifically. Well, it turns out high blood pressure pills, specifically beta blockers, okay, can actually cause to decrease libido. The same way they lower blood pressure in our body, they can lower blood pressure from reaching full blood pressure the way we want it for an erection. Antidepressants, common side effect of many, they call them antidepressants. I like to use the term mood stabilizers. There's some stigma attached with it. But these medicines that we use to affect our mood, even at low doses, can have decreased libido. They can have ejaculatory side effects. In women, they can also cause decreased lubrication and decreased libido too. Alcohol, I think, men, you understand what that can do when it comes to erectile dysfunction, jokes aside. So beware of that, right? We may turn to alcohol because it's pleasant, it's fun, but if it's time for sexy time, you might want to cut back on the alcohol. Even sleeping medicines and even diphenhydramine, which is, Benadryl in the States, these can also affect common medicines that can actually affect libido. So when you have this, you may not necessarily have something that's related to the surgery. It might be something as simple as one of these. So how would you know? You can't know. You first hear it here, then you go to your doctor, either your primary care doctor, a urologist, a sex therapist, and you ask them to find these most common causes. And since I'm on it, sometimes low libido can be associated with low testosterone levels. Not all men will respond to testosterone. Some will. How do you know? You're not meant to know. You ask the doctor, and then they teach you. And if you ask yourself now and you're listening to this, go, what kind of doctor deals with this? I didn't even know there was a doctor for this. There is. There's a doctor for everything, okay? And it doesn't need to be a medical doctor. There are PhDs, there's nurses, there's PAs. And there's wonderful people like Elaine out there who can give you these resources and insight. My main point is, don't be stuck in your bubble. Don't be stuck in these assumptions. There's help. You just need to go ask for it. And simple things might fix the issue that you might be having.
Yeah, that is a great point. And thanks for going through all of those, because I think a lot of people may not be aware of the different other medications they're on and how that is affecting their body and how that can be affecting their sex life or lack of. So in regards to people who have a urostomy, how does that then affect the ability to get an erection, or does it?
It does not necessarily have to affect getting an erection. It depends on why the urostomy was created, but it should not necessarily affect erectile dysfunction. One thing that can happen with the urostomy, though, is having a dry orgasm. So instead of having ejaculate, some men can have a dry orgasm where there's no amount of fluid or semen as you may necessarily be used to. So that can become a little bit of a shock or a surprise. I'll tell you, if you, an organization that Elaine and I both enjoy being patrons of is United Ostomy Associates of America, the UOAA. Their website is ostomy.org. And both Elaine and I are members, and in full transparency, I'm on their advisory board. So, but it's a wonderful nonprofit organization, and they actually have wonderful literature on there for not just ileostomies or colostomies, but also urostomies, every ostomy you can think of. And they even have literature on this specific topic about, sexual dissatisfaction or sexual satisfaction with the urostomy. But typically my patients, they may experience dry orgasm.
Oh, right. Okay. I've never even heard of such things. So there's an education right there. And then in regards to, because we all know that males, when they get to a certain age, can end up taking Viagra or such things. Is that helpful for people who have IBD, or for people who may be having issues with their ostomies due to different, maybe surgery didn't go as well as they thought it might? Can Viagra actually help, or have you heard anything, or has there been any science around that? And
100%. So, the way Viagra works is it causes the blood vessel, or, the cavernosum in your, the two chambers in the penis to engorge. They dilate and engorge and fill with blood. That's what causes an erection. Oftentimes when we think about male ED, we think of the little blue pill, or, Viagra or Cialis, another version. But it's not just about that. There are other options. So if you have tried those and it didn't help, it may not be what explains the entire issue. Sometimes there's blood flow issues. And, jokes aside, you think of Austin Powers. Okay, at least I do, right? The penis pump, right? It's a vacuum. And guess what, guys? It works, okay? A penis pump actually helps engorge blood into the penis. And it works. I'm telling you, it works. But a lot of guys who I've talked to, they may feel ashamed or kind of like laugh it off. They think it's a joke, because it was in a movie, but it's a real thing, and it helps a lot of men. It does. So that's something that can help. Also, penis rings, which are rings that sit at the base. And what do? They help keep the blood in. They help engorge the blood. Now, if you're a man thinking, I do not want to strangulate mini-me, I get it. Okay, we don't want to strangulate mini-me. It's another Austin Powers reference, I guess. Okay, but I want you to think about it. There are different sizes. You can be sized up, and a urologist or sex therapist can actually help size you up and give you some comforting rings that do not sound as uncomfortable as it might. But so sometimes, it's a Viagra-like drug that can help with dysfunction. Sometimes it's a blood flow issue that has to do with age and not necessarily with the IBD at all.
Right. And I know, just for anyone that didn't see the episode last week, it was all about physical therapy for the pelvic floor for all genders. And just that may be something that can help you out, and watch that episode if you haven't already watched it, because that might be all that you need, is to go and see a physical therapist who is trained in pelvic floor to help with any sexual dysfunction that you may be experiencing at the moment. So, Neil, Dr. Nandi, anything else that I'm forgetting to ask, or that comes to mind for you in regards to this topic? I mean, we've covered a ton, and you've enlightened myself and our audience so much. Any other thing?
I can think of maybe 2 or 3 things off the top of my head that you may have already covered, probably in another program. That men may or may not be aware. Women, I think, are more aware. What I'm referencing vaguely enough is clothing, right? So for women, we have more promotion of ostomy, lingerie, ostomy covers. For men, I wanted to remind you, if you don't know already, you probably do though, but just in case you're new, okay? There are, products like stoma cloak that can bind or conceal the stoma. You can wear high-waisted briefs. You can empty your pouch and get a sexy, stoma cover. They're fun. There's lots of people online and on Etsy even that actually make ostomy covers that can help you feel more confident or attractive in that sense. So that's something to think about. 2, so there's ostomy clothing lines and things like that you can do. And, there's a lot of more I can expound upon, but I know it's a commonly discussed tips. So it's easily available online. And if you can't find it, message me or Elaine will provide it to you. 2, I want men to remember one thing. Yes, it's not as much the medicines as more the surgery that can have, depending on how invasive it was in the rectum, that can have an impact on the mechanical nervous system conduction for an erection. But beyond that, what we've touched upon a couple of times is our self-perception. In our society, men have a double standard, right? We hold women to a higher, ridiculous standard of image and beauty in this society. We don't necessarily hold men to it, right? Which is probably a good thing, but we should do that for women too. When it comes to men who have gone through ostomy surgery, who've had surgery or a scar, I find, and this is just my own personal experience, that some men who are having issues with intimacy, the biggest thing when you get into it is that after surgery, they never tried.
All right.
They never tried. They just assumed or just had such low libido, they didn't want to engage their partner or try. This can result in tension and a missed opportunity. There was an interesting study, and this is what I wanted to get to. About 50% of men after surgery, so before surgery, who had their ostomy, were sexually active. And then after their surgery, about 50% of men chose not to be sexually active anymore. This is a small study, a little over 100 patients.
Wow.
It turns out of the other half of patients after surgery, after their ostomy, half of them tried, and 70% of them reported healthy sexual satisfaction. What's my point? You got to try, and don't assume that you're not going to feel satisfied and that your partner's not going to feel satisfied. So my big point is try, get yourself into the zone of sexy time. And try, because you deserve that, right? You deserve sexual intimacy and satisfaction. It's an important thing. Yeah.
Great. So just going to pop over to see if there's any questions from our audience at the moment. And just to remind you, if you're watching this on the replay, please, you can post up your questions. We'll still try and get them answered. I keep on checking in. So whether you're watching on YouTube or Facebook, do post up your questions. Amy Wolf is saying, Dr. Nandi is a champ for discussing these difficult topics. Yes, he is, Amy, and we are so grateful to Dr. Neil Nandi for coming on this evening. So I think that wraps us up. And I'll be coming back to these topics again in the future. But right now, thank you so much for coming on and discussing this, and for helping males to discuss this a bit more, and hopefully go to your doctors and get some more outlets, get more information, and don't be afraid to ask for help. Really, don't be afraid to ask for help. So thank you, Neil, and I will talk to you soon. I'll just wrap things up here. Thank you, everyone, for tuning in this evening. As a reminder, you've been watching myself. I'm Elaine O'Rourke here at Ostomy and IBD Life. You can check out my website. It's elaineo'rourke.com. And please connect with me if you are struggling, if you are having problems with intimacy in regards to IBD, having your ostomy, if you have body image issues in regards to even communication. That's what I work with. I work with people in that capacity. So reach out to me, and please just follow me on, if you're a YouTuber, follow me on YouTube, Elaine O'Rourke, Yoga, Ostomy, IBD, Instagram on Ostomy, IBD Life, and Ostomy and IBD Life on Facebook. All right, everyone, this is the last program of this series. I wish you a happy Christmas, happy New Year, happy holidays, and I will look forward to a new series sometime in the new year. So stay posted for that. All right, be well, everyone.